Lowell and Kabnick, Lowell and Kabnick, in this case, because we just start, I was starting protocol with C6 with VenaBlock. This is something new because there are too many controversial points regarding about using VenaBlock in C6 patients, regarding about complication or maybe any other things that the patient can have. The idea is just to see what are the results and if you are doing fine with the ablation of the final reflux of the patient. The other thing that I have with this lady, she lives 400 miles from here, and she's in excruciating pain. We try to we're trying to help her with regular painkiller that didn't work. We went to Tylenol number 3, Tylenol with codeine, we know the result of. Then, from my point of view, I think I would update the reflux and put some skin graft in those areas that you see here. Just to go down with the pain and see after the ablation if we are able just to fix the pain of the patient. Any comments, any question, Lowell?
Victor, you are not really clear, but I understand what you're saying, I think. Where is the reflux in this patient?
The refluxing point is the full saphenous vein.
Does the reflux come down to the ulcer?
Yes. This is the vein was near to 1.2 centimeters. Both saphenous veins are large. This is one side and this is the other side. It's a little bit larger. The idea is I will update both sides and then we will see what happens. Any questions or any comments regarding about?
Victor, is there a perforator connected to the ulcer?
No, right now there's a small perforator below the ulcer in the left side, but in the right side, the full saphenous vein is open. You have to know that and she's doing a lot over there and she has to do everything by herself. Those patients are very special.
Kürşat, are you hearing him clearly?
No, actually, I cannot. I cannot understand, really.
Victor, you're not clear, and then there's background people talking.
There are too much noise in my background.
We can't hear you clearly because your
Okay.
speaker on your headphones.
Let me try to go a little bit. Si tiene su sonido. Give me a minute. I will get in touch with the guy who is fixing the sound and everything.
That's better. Test it again.
Give me a minute.
No, it's good. Javier. Hola.
Now, do you think much better? Yeah? How is it right now? Now, how is it right now?
Not good. Victor, I might make a suggestion that you do the case and then we can do a voiceover later.
How is better? Much better?
Somebody's talking in the background.
Now, how is much better?
Kürşat, what do you think?
No?
Honestly, I cannot understand very well because the communication is slightly, you know.
It's echoed.
How is the noise right now?
Same.
Nothing? No improvement? Okay. I will try to do the case and then I will.
I'm wondering if it's your speaker headphone.
How is right now? Are you listening much better?
Ya está otra vez. No te escucho nada.
You'll have to just go ahead, Victor.
Okay. Audio. Okay. How is right now?
Better,
Much better? Better?
a little better.
Okay,
Poquito.
fine. Okay, poquito mejor.
See,
Okay. The idea is, because this is a 62-year-old female with bilateral leg ulcers, as you can see. One here and the other here. she was treated with family physicians for so many years with this problem. In the last 3 months, the pain is impossible to hold. She lived alone 400 miles from my office, like in the farm. The only way that we can fix this is doing everything at the same time. The general condition of her is not too good just to advance in something else. Also, if you can see, she is skinny, and the vein is almost near to the skin in some areas. So far, besides that she will have some problem before, the final idea is just to stop the reflux and put some patch over the leg just to see if we can do much better with her. Any question or comments?
How long has she had the ulcers, Victor?
More than the 5 years.
Have they ever healed?
Sorry?
Have they ever healed?
No.
And there's reflux of the great saphenous vein bilaterally
Yes.
and no perforators.
This one is more perforating in that side, in the left side,
Okay.
over here. This is the only one that I have. But the other one, I didn't see anything. But all the veins are going down to the lowest point of. So to prepare everything, I will be just do bilateral ablation with or VenaBlock. You see, we have our set here, have two VenaBlock catheters. We will prepare in 1 minute after I have the access in both sides. We have a 6 French introducer, and I will try to do it as quick as I can. Compresas, tengo ahí. Okay, fine. Suero fisiológico. Tenemos maíz. Javier, ¿alguna pregunta? Me falta hacerlo. Porque hay un peligro de los dos. Si es hacia allá, allá, en el tubérculo. ¿Ok? Fíjate. Pinchazo, señora. Mira, mami. Mhm. Any questions regarding about the Dr. Kürşat? What is your experience in CC patients?
In which patients?
C6.
C6.
Yeah. Definitely, we do superficial problem. We sort out the superficial problem first. It's our routine now. If the patient has deep plus superficial pathologies, we are deciding case by case. Sometimes we do superficial ablation, although we have some problems in the deep system, and we are getting very good results for them. But my first issue is always perforating vein. I know several Americans doesn't think perforating veins are very important or crucial, but for me, I usually like to close the perforating veins in patients with reflux. So my
The
priority.
idea is just, yes, I will go one by one. First, I will fix the axial reflux, and then I will try to do the other one. If I have some later on, I will do the same.
I would like to say that I agree with Kürşat. However, it really depends on the status of the disease process and whether the patient has significant outflow obstruction in the deep system, whether it was a thrombotic patient. If it's a thrombotic patient, I would attend the deep system first. The second, then I would go to the superficial. And then lastly, the perforator, if it's still incompetent. We understand that if it's not that case, then the superficial system should be approached first. And if it's a nibble, then if the ulcer is not healing, then to go after the nibble, and then looking at the perforator. So we really don't necessarily have a unique plan for a patient that we can follow. It's a plan for each patient, and each patient needs to be looked at separately. And I think that's what you were saying, Kürşat, right?
Correct. Totally same idea.
The other problem with her is she is alone at home. There is no wound care center near. There is no nurse who can handle it. And there was one who was helping her a little bit, but she is not around just to do the dressing changes. And this is the other problem that we face with her. How do you approach that kind of trouble over?
That's a really difficult problem when there's no caregiver. She's unable to do it. And so it's not an easy situation.
Yeah. Vamos ahora el trapo de ver todo. Eso que no tiene.
Sí, yo te-
No te mal. Pero igual está. ¿No? ¿Qué? Si lo video cuando quiero que me caiga. Enfrente mío provoca te cae.
Bueno, pues,
¿Qué? Luz. Pues, I'm going to start preparing the VenaBlock. The The second one is already in place. I have both sides. I want to keep the wire because there is an structure like near to the hunter in the right side, but there is not any other problem. Okay, I will start preparing the gun. Sácame dos números ahí. Y acércate, Karen, a grabar. Okay. I'm removing the catheter from the can very soft and easy. I will test the laser. Podemos apagar un poquito la luz. Video de 30 segundos nomás quiero. ¿Qué? Ok, plus. Ok.
Hocam.
Yes. Any question or something else? Okay. Here. Karen. This is the VenaBlock catheter. I just remove from the place that is supposed to be. This is the gun. And this is a 360 syringe. Necesito una hoja 21. Tiene que haber otro allá adentro.
Ya sabes, bueno.
Una hoja 21. Okay. Yes. Okay. Karen. Ahí traen ese guante negro. Now ready to load the glue. There is a cup for the glue. We have to be very careful. Then okay. I have almost 2 cc of glue. Then Una gasa. Taking care of. There is no. Okay. This at the top. Then I will. Okay. We are on set. Then make sure that everything is working properly. Fine. Okay. Log in. I'm ready for the game. Then I have to make sure that when I squeeze the first time, I'm ready just to pump. One, two. Okay. We are almost ready. And we'll go to the saphenofemoral junction. Victoria? Okay. Yes. Arriba, arriba, arriba. Okay. Yes, Victoria. Right. The saphenofemoral junction. Okay. We got it through. I'm following the catheter right now. Okay.
Victor, there's a glare on the ultrasound machine.
Yes, because we have some. Podemos un poquitito uno de los pozos. Voy a sacarle un poquito y apágame toda la luz. I will turn it off full light just to make sure that. This is the tip of my catheter. Now I will turn it on to see where am I. Look. Okay.
We can't see very well.
Okay. I've been trying. No. Sí, look, quiero ver el láser.
We can see
You
that.
see
We
what?
can see the ultrasound well.
Yeah. I will try to do my best in the ultrasound. Give me a minute. Just to leave the catheter in the position that it's supposed to be.
How far from the junction?
3 centimeters is supposed to be. Give me a minute, I will just find out the junction and we'll go. I'm almost, you see over there, this is the tip. Cerrame nomás poquito que si vaya a terminar. I will go a little bit higher.
We don't see by ultrasound, we
I
just
know, give me a minute, yes. This saphenofemoral junction.
we don't see the ultrasound, Victor.
Okay. You try the ultrasound. Mhm. Okay. This is the tip of the catheter. Look, see?
Yes.
Mhm. This is the tip of the catheter. This is okay. This is the tip of the catheter at the saphenofemoral junction. You see? I'm moving right now. Look. Okay. This is the tip of the catheter.
Victor, there's a light that comes on and off. When the light is off, we can see the ultrasound very well. When the light is on, we cannot. Now it's good. Now it's not. Something is flashing in your room.
The screen, my screen is shining. That's why you have that kind of active. Maybe over there, if we move to that side, you
That's
will not
better.
have. Yeah. Okay.
Yes.
Fine. Okay.
Thank you.
I'm up, like you see, this is the saphenofemoral junction. This is the tip of my catheter. I'm almost to 1 centimeter to the saphenofemoral junction. I will go 2 more away, 1, 2 centimeters.
You're on short axis. Go long for us.
Yes, give me a minute. This is short axis. This is long axis.
Good.
You see?
Yes.
Now we will start releasing the glue. Okay? And first, I will go out. Está acá medio que vamos moviendo. Ok. Bueno. Luego desayuno ya. Done. Ok. Ok. Luz, acá, acá. Acá. Okay, first side is done already. All the glue went without big trouble. Vamos a mirar la ecografía, aprieta un ratito. Mira, arriba, abajo, diferente. Necesito el uno desde allá. ¿Está? Mira un poquitito more. We would like to show you that all the vein is closed. Look, there is no, como hizo de algún arriba a la unión safeno-femoral. Ok. Luz, vamos a hacer. Ok. Vamos a mirar unión safeno-femoral. Any questions? Look, the junction is closed. Vamos a mirar un poquito hacia abajo, Victoria. Ok. Una cosa con suero, Gladys. Una aguja con una jeringa con suero. Una jeringa de PCC. Este que tiene.
Ya tiene.
Okay. Now we'll go for the next one. In 1 minute, we finish with the case.
No, yo no muevo porque no puedo. Pero mira, ahí nomás.
Go with the next one. Let's see. Guys, niños hacen femoral. Okay. We have the catheter in place again. See? Okay. Great. Un poquito más arriba, Victoria. Quiero ver la unión umbilical, la unión sacro-femoral, recibimos en este lado. Ahí está. You see? Okay. Minuto, Victoria. Más costado. El catéter ahí está. Here is the catheter. Okay. I will squeeze first time. ¿Cómo ve bien? Karen, acá acá quiero que me grabe un poquitito la pantalla. Date la vuelta hacia acá. I will try to just record the moment when I deliver the glue. You can see. Now you see the glue over there. Click. Estoy apretando el catéter. Ve. Apretamos un poquito. Apretamos. Por ahí abajo. Good. Okay, we did the bilateral glue ablation. You can see that the after like a 30-second, all the veins closed. The polymerization time was really fast. Arriba para abajo. El otro lado. That's it. Look the other side who is completely closed too. Oh, amazing. Javier, ¿alguna pregunta? ¿Qué está ahí? Usando. ¿El otro lado? Sí. Quiero que me grabe, por favor.
Sí, es la.
Apretar un poco ese. Déjame ahí. ¿Ok? Compresa, por favor. Guys, ahí mueve el coso. Mueve acá. Después. Any questions? I finished. I'm done, guys. Any questions? Look. Amazing. Look. Okay. No me está compresa a mí. Professor Kürşat, look. Both of them are sealed. Mi miosa, no femoral, ¿verdad? Sacamos cuántas fotos caen, por favor, acá. Ok. Un minuto. Una jeringa de 3 cc amiral para que el abdomen no destacado. Nada más. Gracias. ¿Está? Ok. Luz, van. Hacer una foto ahí, no sé qué mi video ahí, no.
La foto que voy a quitar.
Sí, mi video,
Se ve muchísimo. Está chiquitito.
hay un video.
Mira, ahora, mira.
Ok.
Ya.
Ujú. Ok.
Foto.
Okay. Lowell, I see Madame already. We close both sides. Was 30-second job. Luz, can we see? I would like just to show you the saphenothermal junction as well as the result after the polymerization of the glue. Look. Más abajo, donde veamos. ¿Ve? You can see the full polymerization of the glue. Acá un poquitito. ¿Ve? Ese punto negro, ¿ve? Ese punto se cerró la vena.
Victor, can you show us again just junction?
Yes, 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 yes.
Junction.
We will record that. La unión safenofemoral quiero ver. Ah, es like, apretá ahí para que vean. Es. Not even Professor Bozkurt will do better.
No,
Sin
no, no, no,
apretar
no.
tanto.
You did a very
Look.
good job, definitely. Fantastic job.
Ok. Video ahí. Del otro lado. Let's do the second one. Thank you very much. I would like to release you guys because we have our rounds a little bit. Look, this is the other side. Check. You see? Right side. Okay. Take pictures. Photo ahí. Okay. Bajamos hasta abajo. Any question, Lowell? Javier, ¿alguna pregunta?
No se escucha. No se escucha.
Javier.
Doctor. No se escucha.
Javier, Lowell, ¿alguna pregunta?
Kürşat, if
Any
you
question?
put on color flow, will you see areas that are not yet closed until the glue polymerizes?
Yes, definitely. Just around the glue, you can see in many patients some not blocked areas, but a couple of days after it's just blocked. So there is no question about that.
If you see propagation of glue into the deep vein, does that occur immediately or just glue? That occurs immediately, right?
Immediately.
What about thrombus and glue?
Thrombus may propagate later, 1 or even 2 days later, but usually after 3-4 days, all stabilized. So if you do, for example, ultrasonic examination, I usually do after 24 hours and see how it goes. So if it's no problem after that.
Thank you. Well done, Victor.
Good job.
Okay, I want to leave you guys. Have a good one. Thank you very much. And we will
Bye-bye.
put it and then keep
Bye-bye.
working on it. Thank
See you
you.
at
Bye bye.
Bye.
Sí.
Perfecto.
Así.